हाँ जी वेलकम करते हैं तुहाडा सारिਆਂ ਦਾ नर्सिंग करियर चैनल के उत्ते। सो जिहड़ा GMCH का एग्जाम होया सी उहदे आपां 30 क्वेश्चन कर लए सीगे। नैक्सट स्टार्ट करते हैं। सो वीडियो स्टार्ट करन तो पहलां सब नूं रिक्वेस्ट आ भी चैनल नूं सबसक्राइब जरूर कर दिया करो ताकि हरेक वीडियो की अपडेट तुहाडे तक पहुँच सके। सो स्टार्ट करते हैं 31st क्वेश्चन। 31st क्वेश्चन दे विच हैगा जी पल्स ऑक्सीमीटर इज़ यूज टू मैज़र। सो पल्स ऑक्सीमीटर दे लई मैज़र करन दे लई की यूज़ किया जाता। दिस इज़ वैरी मोस्ट इंपॉर्टेंट एंड ईजी क्वेश्चन। ए ऑक्सीजन सैचुरेशन ऑफ ब्लड। सैकेंड ऑप्शन है पल्स रेट। सी बोथ ए एंड बी एंड डी नन ऑफ दीज। सो राइट आंसर इज बोथ ए एंड बी means pulse oximeter is used to measure oxygen saturation of blood and pulse rate. So right answer is option C. Next question number 32. Range of motion depicts. So what is the range of motion depicts? A exercise that move each muscle and joint, arc of movement of joint, direction of movement of limbs, and none of these. So the right answer is A. Range of motion depicts means exercise that move each muscle and joint, that is a range of motion. So option A. Next question number 33. For a patient with severe hearing disability, so nurse should face the patient and speak clearly and distinctly, shout and use exaggerating mouth movements, keep silent, communicate with family only. So for a patient with severe hearing disability, so nurse should, so right answer is option A, face the patient and speak clearly and distinctly. So option A is the correct answer. Next 34. Trochanter role is used to. So trochanter role is used to, options ne prevent internal rotation of hip when the patient is recumbent position. B. Prevent external rotation of hip when patient is recumbent position. Next, prevent internal rotation of hip when patient is in standing position. Next, last option is prevent external rotation of hip when patient is in standing position. So trochanter role is used to, option B, prevent external rotation of hip when the patient is in recumbent position. So option B. Next question 35. Wrist drop is a condition in which flexor muscle of wrist and digit do not work, extensor muscle of wrist and digit do not work, abductor muscle of wrist and digit do not work, and last is adductor muscle of wrist and digit do not work. So wrist drop is a condition in which is a extensor muscle of a wrist and digits do not work. So option B is the correct answer. ਇਹ क्वेश्चन ਸੀ ਜਿਹੜੇ GMC एग्जाम ਦੇ ਵਿੱਚ ਪੁੱਛੇ ਗਏ ਨੇ। ਸੋ ਇਹਨਾਂ ਦੇ ਵਿੱਚੋਂ ਹੀ ਰਿਪੀਟ ਹੁੰਦੇ ਰਹਿੰਦੇ ਆ। ਹਰੇਕ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ ਕੋਈ ਨਾ ਕੋਈ ਐਗਜ਼ਾਮ ਪੁੱਛਿਆ ਜਾਂਦਾ। ਸੋ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ। ਨੈਕਸਟ ਆਪਾਂ ਚੱਲਦੇ ਹਾਂ 36 क्वेश्चन ਤੇ। The best nursing practice is to prevent ventilator associated pneumonia is A. Reduce exposure to mechanical ventilation, excellent oral care and subglottic suctioning, promoting early mobility, all of these. So right answer is all of these. Best nursing practice to prevent ventilator associated pneumonia is all of these. So option D is the correct answer. Next 37th. Ideal solution for replacement of intravascular volume, so non-hemorrhagic, would be blood transfusion, blood substitute, isotonic solution, and colloid solution. So the right answer is option C, isotonic solution. Next 38. Most common cause of postpartum hemorrhage. So what is the most common cause of postpartum hemorrhage? It's a bleeding disorder, abruptio placenta, placenta previa, and atonic uterus. So right answer is atonic uterus. Next 39th. Which of the following cell of the body are in almost constant mitosis? Nerve cell, stomach cell, muscle cells, renal cells. So the right answer is stomach cells. Option B. Next question number 40. The total lung capacity in healthy adult male is approximate. So what is the total lung capacity? It's a 6000 ml. Option D is the right answer. Next 41. Which among the following is an example of isotonic intravenous solution? It's a dextrose normal saline, 10% dextrose, 0.45 NaCl, and last is Ringer's lactate. So right answer is option D, Ringer lactate. Next 42. WHO declared that 2019 novel coronavirus outbreak as a public health emergency of international concern on 30 January 2020, 13 January 2020, and C 23 January 2020, and option D 27 January 2020. So right answer is option A, 30 January 2020. Next 43. In which of the following client is the rectal temperature most usually contraindicated in? Client who had a myocardial infarction, client with Parkinson's disease, client who is prone to seizures, and client with neuropathology associated with diabetes. So which of the following condition is a rectal temperature most usually contraindicated in? Client who has myocardial infarction. So right answer is option A. Next go to the 44th. In meiosis, how many daughter cells are produced? So 8, 6, 4, 2. So 6 नहीं, option 44 the right answer हैगा 4. In meiosis, how many daughter cells are produced? 4 cells are produced. Option C. Next, which hormone produced by the ovaries inhibits the secretion of SHA and LH? Progesterone, estrogen, inhibin, and GnRH. So the right answer is inhibin. Option C. Next, question 46th. The enzyme pepsin digests which dietary component? Proteins, fats, carbohydrates, vitamins. So right answer is proteins. Option A. Next 47th. The most abundant tissue in human body is epithelial tissue, connective tissue, nervous tissue, muscle tissue. So right answer is connective tissue. Next 48th. Quality assurance in nursing is concerned with adequacy of care, practice ratings, standard of practice, organizational practice. So right answer is option C, standard of practice. Next 49th. Deformity of dash bones resulting in springle soldier, scapula, radius, ulna, tibia. So right answer is scapula. Last is 50th. Smallpox vaccine was invented by, see this is very easy question. So smallpox is invented by Louis Pasteur, Paul Agoni, Edward Jenner, John Snow. So right answer is C, Edward Jenner. Smallpox vaccine was invented by Edward Jenner. Next 51. Embiosis is transmitted through fecal oral route, vector-borne, parental, airborne. So right answer is embiosis is transmitted through a fecal-oral route. Our right answer is option A. Next, maximum amount of vitamin D is found in which among of the following? Liver, cheese, egg yolk, cod liver oil. So right answer is option D, cod liver oil. 53. So this is very easy question. 3 Ds. Diarrhea, dementia, dermatitis are the characteristics of which deficiency disorder? Thiamine, biotin, niacin, riboflavin. So right answer is niacin, option C. 54. Which of the following antitubercular drugs causes red orange discolorization of urine? So right answer is option D, rifampicin. Next, 55. Absence of vowel sound and abdominal distension after abdominal surgery indicates option C, paralytic ileus. Next, 56. Unwanted but unavoidable pharmacodynamics effect of a drug at a therapeutic dose is known as hypersensitivity, side effect, toxic effect, idiosyncrasy. So right answer is 56 the right answer हैगा B, side effects, option B. Next, 57. Which of the following is the organism that causes peptic ulcer disease? Staphylococcus, Corynebacterium, Halobacter pylori, Streptococcus. So right answer is option C, Halobacter pylori. Option C is the right answer. Next, 58. When the amount of amniotic fluid exceeds 2 liters, the condition is called oligodrymanous, polydrymanous, bag of water, amniotus. So right answer is polyhydramnios. Next, 59th. Limit for registration of birth in India. This is also very easy question and most repeated question. 7 days, 21 days, 14 days, any of the above. So limit for registration of birth in India is 21 days. 60. In identical twin where the fetus share common chorion, so number of placenta is only 1. Option A. Next, question number 61. Sports person enhance mental and physical capabilities by taking anabolic steroids, caffeine, whiskey and high calorie food. So right answer is anabolic steroids. जो sports person होते हैं वो अपनी mental और physical capability क्या लेकर enhance करते हैं? Anabolic steroids लेकर. So option A. Next, 62. The silent feature of nurse record include the following except. So silent feature of nurse's record in which of the following but except. Written with ink on paper, ये भी permission है. Complete, clear and concise. Countersigned by the doctor, should not have overwriting. So right answer is इनमें क्या नहीं होना चाहिए? Written with ink on paper. Next, 63. The ability of the human body to defend itself against a pathogenic agent. It's a resistance, tolerance, immunity, adaptation. So right answer is immunity. 64. Fifth disease is also known as mumps, erythema infectiosum, measles, rubella. So right answer is erythema infectiosum. Fifth disease is also known as erythema infectiosum. Next, 65. In which part of the fallopian tube fertilization take place? In fundibulum, ampulla, isthmus, interstitial part. So right answer is ampulla, option B. 66. Who is known as father of aseptic surgery? Hippocrates, Joseph Lister, Louis Pasteur, Solman, Waxman. So right answer is who is the father of aseptic surgery? It's a Joseph Lister. Next, World Mental Health Day is observed on 11th July, 10th October, 7 April and 5th June. So right answer is 10th October. Next, 68. Soldier dystocia is managed by Lovset maneuver, Leopold maneuver, MC Robert maneuver and Bern Mancher maneuver. So right answer is option C. MC Robert Manuvure. Next, 69. A normal human cell has a dash chromosomes. This is also very easy question. 46 chromosomes. Next, 17th. One of the major complications due to mumps in males is weakness, sterility, earache, and meningitis. So right answer is one of the major complications due to mumps in male is sterility. Option B. ਸੋ ਜਿਹੜੇ ਨੈਕਸਟ ਕੁਐਸਚਨ ਨੇ ਉਹ ਆਪਾਂ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ ਡਿਸਕਸ ਕਰਾਂਗੇ। ਸੋ ਕਾਫੀ ਇੰਪੋਰਟੈਂਟ ਕੁਐਸਚਨ ਪੁੱਛੇ ਗਏ ਸੀਗੇ GMC ਦੇ ਐਗਜ਼ਾਮ ਵਿੱਚ। ਸੋ ਇਹ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਓ ਕਿਉਂਕਿ ਹਰੇਕ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚੋਂ ਹਰੇਕ ਇਹ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ ਲਈ ਇੰਪੋਰਟੈਂਟ ਕੁਐਸਚਨ ਨੇ, ਤੁਸੀਂ ਕੋਈ ਨਾ ਕੋਈ ਇਹਨਾਂ ਵਿੱਚੋਂ ਆ ਜਾਂਦਾ। ਸੋ ਵੀਡੀਓ ਨੂੰ ਐਂਡ ਤੱਕ ਜ਼ਰੂਰ ਦੇਖਿਆ ਕਰੋ ਅਤੇ ਮਿਲਦੇ ਹਾਂ ਆਪਾਂ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ। ਇਹੀ ਕੁਐਸਚਨਸ ਨੂੰ ਆਪਾਂ ਅੱਗੇ ਕੰਟੀਨਿਊ ਕਰਦੇ ਹਾਂ। ਓਕੇ ਗਾਈਜ਼।